Hello and welcome to my podcast. I'm your host, Ben Lilly, and today we'll be discussing sickle cell anemia. Just quickly, there is two forms. If you could fill out the before form now, just before you've listened to the podcast, and then after you've listened, just fill out the after form. In this podcast, we'll be discussing the history of sickle cell, how it affects those with the disease, what treatments are available, and how they help. And at the end, we'll have a little brief recap, a summary, going over everything we've talked about. Sickle cell is a genetic disease which is caused by a person inheriting the same deficient gene from both parents. So, if a person just inherits the deficient gene from one parent, they'll be known as a carrier, and they won't suffer from sickle cell anemia, but can still pass on the deficient gene. The disease affects approximately 20 million people worldwide, and according to the National Heart, Lung and Blood Institute, 1 in 13 African Americans are born with the sickle cell trait. A great amount of progress has been made for treating those with the disease, as around 40 plus years ago, the amount of children that were able to survive to adulthood was around 50%, but currently 94% of children are expected to survive to adulthood. So let's talk about where it began. James Herrick is the first person that ever recorded the disease, which happened in 1904 when he met with a 20-year-old student to evaluate a respiratory infection. However, it was discovered on the blood smears that the erythrocytes were thin and sickle-shaped. The case was published in 1910 after observing the student for a few more years, but only in 1922 was the name sickle cell anemia selected. This means that the disease has been around for around a century. But why has it not been cured? You might be asking, it's been around for a century. Has any progress been made? Well, yes, actually loads of progress has been made. As comparing life expectancy in the 1970s and before, a person really wasn't expected to live past the age of 20. However, in the 1990s, the mean age a person would live to was around 48. And this is still going up today as treatment for the disease is becoming a lot more accessible. So, with the history overview out the way, let's discuss the effects of sickle cell anemia. Sickle cell anemia can have a variety of effects on the body, the most common being acute pain episodes or pain crisis. Now, you're probably wondering what a pain crisis is. Well, let me explain. An acute pain crisis is when a person suffers from painful episodes in various parts of the body, being the chest, legs, back, or arms. These are spontaneous episodes that last about a week with two main phases. Firstly, a person in the first 2 days will suffer from aching pain and feelings of fatigue. However, there is an extreme increase in pain a person feels on day 3 to 7. The pain levels that a person faces will vary person to person, with some cases being very mild and quite manageable at home, to other cases being extremely severe and leading to the person having to go to the hospital. Well, now we know what happens to a person that suffers from an acute pain crisis, we also need to understand how it happens. Well, it's down to vasoocclusions, which is just a fancy word to say when blood vessels become blocked up. The reason this happens in people suffering with sickle cell disease is because of the change in the blood cells. See, as these new sickle-shaped blood cells that I mentioned earlier lose their flexibility, they have a higher chance of sticking to the blood vessel walls. I think that a good way to try and imagine this is blood vessels being like a road and blood cells almost like cars. So if a person doesn't suffer from sickle cell disease, the cars can go straight down the road. There'll be no problem with that. However, if a person suffers from the disease, the cars take different shapes and they cause more blockages and can't really pass each other. Another effect a person with sickle cell disease is likely to face are strokes. A review article by Louis Verduzco and David Nathan in 2009 found that 24% of sickle cell patients suffer from a stroke by the age of 45. The most common type of stroke in sickle cell patients is ischemic strokes. This type of stroke will cause a blood flow blockage. There are also other types of strokes which are less common, hemorrhagic, which cause bleeding around the brain. Focusing on ischemic strokes, they are caused by a mutated beta-globin gene. The mutation affects a particular hemoglobin, hemoglobin S, which will behave like a normal hemoglobin when it's oxygenated, but when it is deoxygenated, the mutation causes it to polymerize. This causes a gel formation, which then leads to the red blood cells becoming deformed and stickier. So now, after we've had a brief look at the effects that sickle cell has on a person, we're now going to look at the treatments that are available. Currently, there is no way that you can cure sickle cell disease. Or is there? As there are various drugs that provide reduced symptoms that help make life for those with the disease more manageable. One of the methods is through the use of hydroxyurea, which is also used to medically treat cancer by stopping the cell growth. However, in this case, the use of hydroxyurea helps sickle cell patients with a reduced number of vaso-occlusion crises, as well as reducing the need for an urgent blood transfusion. The hydroxyurea helps increase fetal hemoglobin levels, which helps prevent the red blood cells from becoming sickle-shaped. This is because they have a high affinity to oxygen, and which means that oxygen basically can bind to the hemoglobin a lot easier. So the red blood cells instead are able to stay flexible and keep their round shape. It has also been reported that the number of painful episodes a person with sickle cell disease suffers from can be reduced by up to 50%, as well as reducing the need for blood transfusions quite significantly. So, why aren't all patients suffering from sickle cell disease using hydroxyurea? Well, the short answer is the costs and availability. As most people that use hydroxyurea find it works great with little to no side effects. However, a study evaluating the effectiveness and usage of hydroxyurea in Nigeria found a high number of people who just couldn't afford the treatment or it wasn't available. Sickle cell disease can also be helped through blood transfusions, in which a person receives a blood donation. This blood does need to have matching antigens in order to have any effect, as if the antigens aren't matching, the body will attack the new blood. Once donated correctly, the patient will be at much less risk of facing any problems related to sickle cell, as the new healthy blood cells remove the risk of cluttering in blood vessels. However, again, there are risks with blood transfusions, as certain studies have shown that it can induce the pain crisis, strokes, all types of effects from sickle cell due to blood viscosity or even increased blood pressure. And for blood transfusions to have a really good effect, they need to be administered every 2 to 4 weeks. Meaning that because of this high frequency, there needs to be a lot of blood in supply. And the issue with this at the minute is there is a lack of blood available. So a post from the NHS blood donation says that the average person with sickle cell disease needs about 100 blood donations a year to stay alive. And they are in need of around 12,000 donors. So it has a great effect and is able to really help people when it's available. But due to the lack of blood available, it isn't the most effective treatment. Now, the last treatment that we're going to talk about is bone marrow transfusions, arguably the only known method that can actually successfully treat sickle cell anemia. The idea of a bone marrow transplant is to prevent the formation of the mutated blood cells containing the hemoglobin S. If you didn't know, a person's bone marrow is where the blood is produced, so if the bone marrow is successfully transplanted, the person should then start producing healthy blood cells. This means that they won't sickle anymore and they will be the regular shape. The procedure works by a doctor injecting the healthy stem cells into your body. Once inside, then the bone marrow will start producing the blood cells, so the healthy blood. So it's quite a long procedure, so it can take up to a year, as in the first 2 weeks you go through chemotherapy, just so your immune system won't reject the new stem cells, but it also means that your immune system will be weak, and you then are susceptible to infections. Then, for about a month after the procedure, you'll be watched by a care team. And then, for your immune system to actually recover, it could take up to a year. It is also a very, very expensive procedure, with the UK being around £15,000. And in America, it can be up to $250,000. Okay, well, this is the end of the podcast. So let's just quickly go over what we've covered then. So, as we now know, sickle cell is a genetic disease that affects around 20. We also now know that the disease was first documented in 1910 by James Herrick. However, only in 1922 was the name sickle cell anemia selected. As well as talking about the history of sickle cell, we covered various effects it has on the person. The ones that we covered were acute pain crisis and strokes. These are only a few of the many effects that a person may suffer from if they have sickle cell anemia. Lastly, we covered various treatments and looked at how useful they are and some of the issues that they may have. The treatments that we looked at were hydroxyurea, which is a drug that helps reduce symptoms of sickle cell. However, some people can't use it just because of the cost. Another treatment was the blood transfusions, which also, like hydroxyurea, can reduce the symptoms a person with sickle cell may suffer from, but the availability of blood for these transfusions is currently a big issue. And lastly, we looked at bone marrow transplants, which is actually the only method that can be used to treat the disease. However, it's extremely expensive and can take a long period of time. Well, thank you so much for stopping by and listening. I hope now that if you had no clue what sickle cell was, or even if you did, that you've come away with a better understanding of the disease. In the description below, as I mentioned earlier, there is the after form. If you could fill that out, that would be amazing. And that is all. Thank you very much.